some of the challenges of adolescence. We know today that about 14% of adolescents aged 13 to 18 experience a mood disorder. And what we mean by that is something like depression, sadness. That's about 14% of teens. About a third of teens experience an anxiety disorder, and about 19% are diagnosed with some kind of behavior disorder. 11% of teens have a substance use disorder. So this might be around alcohol or drugs, narcotics, opiates. So what that means overall is about a quarter of all teens have some kind of severe impairment or distress that they live with every day. And a few more statistics. From 2012 to 2015, depression increased among girls by 50% and among boys by 21%. And in 2014, compared to 2007, among those teens aged 12 to 14, 3 times as many girls and 2 times as many boys took their own lives. I want to say that again because that is just to me an absolutely astounding statistic. So in 2014, compared to 2007, among those teens who are 12 to 14, 3 times as many girls, twice as many boys took their own lives. And this was pre-pandemic. We know that now things are much worse. So, knowing that teens are having a really hard time, how can self-compassion help? How can self-compassion help to mitigate some of these problems that youth are experiencing? So in order to do this, what I'd like to do is give you a definition of self-compassion first. But actually, I'm not going to give it to you. I'm going to let you discover it for yourselves. And we're going to do this through an exercise. So if you have something to write with and something to write on nearby, that would be great. If not, you can do this exercise in your head. And what I'd like you to do is think of a time when a good friend of yours was having a really hard time. They had a really hard day. Something happened that made them feel really inadequate, unworthy. Maybe they felt like a loser. And they came to you. What did you say to them? And what tone of voice did you use? Perhaps what were your body, what was your body posture, or what gestures did you use? If you can't think of a time, think of what you might say if this were to happen. And I'll give you a few minutes to think about this. Okay. Now what I would like you to do is think of a time when you felt like you failed, when you had a really hard time. Maybe you had a difficult day. You maybe had a problem at work or difficult conversation with somebody at home, with your child or with a partner, or um, you you felt badly about yourself. You felt inadequate. You felt perhaps like a loser. You felt unworthy. What words did you say to yourself? And what tone of voice did you use? Now, I'll give you another minute or so to think about this. And again, if you have something to write with and something to write on, you can jot this down. Okay. So if you're like most people, in fact, about 80% of us, you treat yourself much more harshly than you treat your good friends. You say things to yourself that you would never in a million years say to a good friend. You have a very different tone of voice with yourself than you do with a good friend. And so one way that we define self-compassion is when we're dealing with difficulties and challenging times, treating yourself the way you would treat a good friend. Saying the kinds of words to yourself that you say to your good friends. So that's the informal definition of self-compassion. And there's a more formal definition of self-compassion as well. And this definition was offered by Dr. Kristin Neff in 2003. And it has 3 different components. So the first component of self-compassion is mindfulness. And within this definition, mindfulness means having a balanced perspective. So in these times, during these times when you're struggling, when you're having a hard day, or you're feeling inadequate, understanding and knowing that this is not the end of the world, that this will pass, and not spinning out. So what I mean by that is what we tend to do when something bad happens to us is we tend to think that, this is the end of the world. Well, I had this difficult conversation with my supervisor at work, and I know what's going to happen. I know what this means. I know it means that I'm going to come into work tomorrow, and they're going to call me into their office, and they're going to tell me that I don't have my job anymore. I'm going to be fired. And I know I'm not going to be able to get another job because this is going to be on my resume. So I'm going to end up living out on the streets and eating out of garbage cans. And so our minds tend to do this, right? Now, this is a little bit of an exaggeration, but our minds tend to spiral out in this way. So the opposite extreme of mindfulness on the other side of the spectrum is what we call over-identification or catastrophizing. We tend to catastrophize about the situation. So mindfulness is just having a balanced perspective, understanding that this is going to pass. Maybe it wasn't my best moment, but it's not the end of the world. The second component of self-compassion is common humanity. Common humanity is the understanding that these feelings that we experience in these moments, these feelings of hurt or anger or sadness or frustration, are just part of being human. And as human beings, we all experience them. Now, this may sound like something that we know all the time. Intellectually, we do know it. But when we're actually in that place, when it actually happens to us, we tend to forget. We tend to think that we are the only ones, that this only happens to us. We're the only one who has difficult conversations with our supervisor at work, or we're the only ones who have children who are arguing with us. Everybody else's children are really well behaved, So we tend to isolate ourselves, and we tend to feel very much alone. So again, common humanity is the understanding that these are that we're part of a humanity, of a population of people roaming around on this planet that experience just the same kinds of emotions that we do. And then the third component of self-compassion is self-kindness. The opposite of self-kindness, or the opposite extreme on the other end of the spectrum, is self-judgment or self-criticism. So in these moments when we're having a difficult time, we can choose to be kind to ourselves, to treat ourselves the way we would treat a good friend. But that's not generally what we tend to do. We tend to be really hard on ourselves. We tend to even say mean things to ourselves. We might say things to ourselves like, ugh, you're such an idiot. You're so stupid. Why do you say such stupid things? You know better than that, But we don't have to. So part of self-compassion is understanding that we can be kind to ourselves. And there's an active component to self-kindness. It's actually about doing something nice for ourselves, or saying something nice to ourselves, saying these kind words to ourselves, or maybe even doing what we call behavioral self-compassion. And this means going for a walk, perhaps, or having a nice, relaxing cup of tea. If you're a teen, this might mean, maybe calling up a friend, talking to a friend on the phone, doing something fun, something that you enjoy doing. These are the three components of self-compassion. So I'd like to bring these three components together in a practice that we call self-compassion break. And this is a practice that you can do at any time. We call it an informal practice because you can do it right in the moment when you're feeling like you're starting to struggle a little bit. Maybe you're getting frustrated or angry or anxious, and you don't know what to do. You can drop right into this practice. This practice incorporates all three components of self-compassion. And you can do it very quickly, really in about 10 seconds. Right now, I'm going to stretch it out. It's going to be longer because I want you to see the three different components of self-compassion here. So as I said, generally you do this when you're feeling a little bit stressed. And hopefully you're not feeling stressed right now. So what I'm going to do is elicit a little bit of stress in you so that you can practice this self-compassion break. And I apologize for that in advance.
지금부터 여러분 삶에서 스트레스를 불러일으키는 것에 대해 생각해 보겠습니다. 직장이나 집에서 해결해야 할 문제일 수도 있고, 건강이나 친구의 문제 또는 관계의 문제일 수도 있습니다. 잠시 스트레스 받는 일을 떠올리면서 상황을 잘 그려보세요. 누구와 연관되었으며 누구에게 무슨 말을 했는지를요. 우리는 지금 실습을 어떻게 하는 것인지 배우려는 것이니 너무 스트레스가 되는 상황을 고르지 않도록 합니다. 우리 몸이 느끼는 스트레스 크기를 1에서 10까지라고 한다면 그 중에서 3, 4 정도의 스트레스 상황을 선택해 주세요. 좋아요. 이제 스스로에게 이것이 고통의 순간이구나, 도전적인 순간이구나 라고 말해줍니다. 또는 지금 너무 힘들다, 어렵다고 말해줄 수도 있습니다. 여러분이 해야 할 일은 고통을 표면으로 드러내고 인정함으로써 그것이 지금 여기에 있음을 인식하는 일입니다. 이것이 자기연민의 요소 중 마음챙김입니다. 그런 다음 스스로에게 고통은 삶의 일부이고 나는 혼자가 아니라고 되뇌어 보세요. 우리 모두는 언제 어느 순간부터 이것을 경험해 왔습니다. 이것은 인간 존재의 일부이자 이 행성을 살아가는 보편적 인간 경험입니다. 이제 스스로에게 말합니다. 지금 이 순간에 나에게 친절하기를, 나에게 필요한 것을 주기를. 그리고 이런 말을 스스로에게 해봅니다. 나는 강하다는 걸 알기를, 내가 강해지기를, 힘과 용기로 이 순간을 맞이할 수 있기를. 이겨내기 위한 인내심을 가지기를. 지금 이 순간 나 자신에게 필요한 사랑과 연민을 줄 수 있기를. 만약 이런 말들이 조금 어색하거나 불편하다면 비슷한 문제로 어려움을 겪고 있는 좋은 친구에게 무슨 말을 해줄지 생각해 보세요. 그들에게 무슨 말을 어떻게 하실 건가요? 여러분 자신에게 똑같은 말을 하거나 그런 친절한 말들을 해줄 수 있나요?
Okay, so this was self-compassion break. And you might want to take a moment or two to just reflect on what this experience was like for you doing the self-compassion break. If you had some struggles with it, please remember that we're not used to being kind to ourselves, so it feels uncomfortable at first, and it does for a lot of people. Just like anything that we do for the first time feels awkward and uncomfortable. As I mentioned earlier, we're not raised to be compassionate to ourselves. We're raised to be compassionate to others. So many of us, most of us actually, have doubts about self-compassion. Is this real? Will this really work? Or even misconceptions or misunderstandings about self-compassion. And one of the biggest doubts that people have about self-compassion is that it will make them unmotivated. It will make them, just happy lying on the couch, watching Netflix, eating chocolate all day long. And what we know actually from research is that people who are self-compassionate are actually more motivated because they know that if they fail, if they start something new, if they move outside of their comfort zone and try hard to achieve something and they fail, that they're not going to beat themselves up. They're not going to be so harsh to themselves, that they will accept their failure and they'll move on. So these are a couple of studies that were done that demonstrated this, that those with greater self-compassion were actually more motivated to improve what they had seen in themselves as personal weaknesses. They tend to procrastinate less, and they're more likely to move outside of their comfort zone. And this last study is one that we did at University of North Carolina at Chapel Hill with teens. What we saw with teens was that those who are more self-compassionate were more likely to embrace new experiences and stretch themselves beyond their comfort zones to try new things. Another doubt that people have about self-compassion is that it's like self-pity or being selfish. We know it's different than self-pity because of the common humanity element. So in other words, people who are self-compassionate don't say necessarily, oh, poor me, I'm struggling so much. They might say, oh, I'm struggling, this is hard. But this is part of being human, and you're struggling also, and so is everyone else, right? This is part of the human experience. Research has also demonstrated that those people who are more self-compassionate are actually more likely to show concern for others, to be compassionate to others, that they're more ready to forgive others, and they're rated by their partners as being more caring and supportive. And some people think that when you're self-compassionate, you're being self-indulgent. But being self-compassionate is like reparenting yourself in a way. So in other words, it's like the good parent, the healthy parent who says to their child, I'm not going to feed you sweets all day long. I'm not going to do that because that's not good for you. It's not good for you to eat desserts all day long. I might give you some desserts, but I'm also going to give you fruit and vegetables and healthy food. So the same goes for ourselves. We do what's best for ourselves when we're self-compassionate. We do what's healthy for ourselves in the long run. So research also has demonstrated this, that those who are high in self-compassion are more likely to exercise, to stick to their diet. They're more likely to seek medical help when it's necessary. And they treat themselves as in healthy ways in this regard. And then there are those who are afraid that self-compassion is weak, that strong people aren't self-compassionate, We also know that this isn't true. In fact, Kristen Neff just published a book on fierce self-compassion and how self-compassion is also about protecting yourself and it's motivating, and it's about standing up for yourself when necessary and fighting for what you believe in. So there's a fierce side of self-compassion, a very important fierce side. There's a tender side of self-compassion and a fierce side. We call this the yin and yang of self-compassion. And research has shown that those who are higher in self-compassion are better able to cope with trauma, with divorce, with chronic pain, with academic trouble at school, and with child maltreatment. So those people who are higher in self-compassion are better able to deal with these kinds of challenges that they encounter in life. And then another doubt that people have about self-compassion is that it's a form of making excuses or letting yourself off the hook. And what we know from research is that people who are more self-compassionate are actually take more responsibility for their mistakes and for places where they have messed up, because they know it doesn't mean that they are a terrible person. So they're willing to step in and say, I'm sorry, I made a mistake. I shouldn't have done that. I will correct my mistake. I will do what's necessary to amend what I have done, because they know it means that they're not a horrible person. They know it means that they're a good person who made a mistake. And there's a big difference here, which I'm sure that you can recognize. And again, another research study showed that they're more likely to apologize when they've offended someone. So the same kind of reasoning goes here. They're more willing to step in and apologize because they know it doesn't mean that they're overall a horrible person. So the next practice that I'd like to do with you is called supportive touch. And this is one that is very easy and quick to do, and you can do anytime, anywhere. And actually, it's one of the favorites of the teens that we teach. So what I'm going to do is demonstrate a number of different practices, a number of different supportive touch gestures, so that you can try them out and choose one or two that work for you, or perhaps you have your own gesture that works for you, and that's fine. Before I do that, however, what I'd like to do is explain a little bit about the science behind supportive touch. So we readily give supportive touch to other people, to our friends. If a friend is having a hard time, we would think nothing of giving them a hug or putting our arm around them or maybe a pat on the back. We even do this for our pets, you know. We might go over to our dog or cat and pet them. Feels good for the dog or cat. Feels good for us. We don't do this for ourselves. And the only reason we don't do it for ourselves is that we're just not used to it. But we can. And we can comfort ourselves in this way. This comes very naturally to us, doing it for other people, because it elicits a physiological response in our bodies, a release of a chemical called oxytocin, which is what we call the feel-good hormone or cuddle hormone. It makes us feel good and it makes the other person feel good. This is the hormone that's released when a mother nurses her child, her baby. There's a release of oxytocin. It's also released when we do these gestures, these supportive gestures for others and for ourselves. Okay, so that was my little bit of introduction, and now we'll try them out. Sometimes, actually for most people, it's a little bit easier to do with your eyes closed.
눈을 감으세요. 물론 눈을 감고 싶지 않다면 그러지 않아도 좋습니다. 동작의 느낌을 더 많이 느낄 수 있기 때문에 저는 눈을 감는 것을 선호합니다. 한 손에 다른 손을 포개어 서로 만져지는 두 손의 느낌을 알아차리는 것부터 시작할게요. 어떤가요? 한 손이 다른 손에 닿는 부분에서 약간의 따뜻함을 느낄 수 있습니다. 손을 서로 비비면서 그 느낌을 알아차려 봅니다. 한 손으로 팔 위쪽을 쓰다듬으며 그 느낌을 알아차려 봅니다. 두 팔을 교차해서 양쪽 팔 위를 쓰다듬거나 자신을 꼭 안아주거나 두세 손가락으로 뺨을 쓰다듬거나 양볼에 손을 얹어봅니다. 얼굴에 손을 대고 그 감각을 알아차려 보세요. 어떤 느낌인가요? 심장 위에 한 손을 올려놓고 손의 온기와 부드러운 압력을 알아차려 보세요. 이번에는 심장에 두 손을 올려놓고 손으로 심장 위에 작은 원을 그려보세요.
with your hand.
다시 한 손은 심장 위에, 다른 손은 배 위에 올려놓고 어떤 느낌인지 알아차려 봅니다. 아니면 한 손으로 주먹을 쥐어 심장에 대고 다른 손을 그 위에 대고 느껴봅니다. 이번에는 한 손을 이마에 대거나 목 뒤에 손을 대어 보세요. 여러분 무릎 위에 한 손을 놓고 다른 손으로 부드럽게 어루만져 줍니다.
Okay, so that's supportive touch. And hopefully you found one or two gestures that work for you, that were somewhat comforting for you. So now I'd like to talk about the research. And first, just to give you an overview of the research, I'm going to highlight two meta-analyses. And for those of you who don't know, a meta-analysis is a statistical summary of a number of other studies. And the first one that was published on self-compassion in teens was in 2018 by Marsh, Chan, and Macbeth. And what they did was they looked at a number of different studies that had measured what they termed psychological distress, which was grouping depression, anxiety, and stress together. And they looked at how that correlated with self-compassion. And what they found was that there was a strong inverse correlation between self-compassion and psychological distress or psychopathology. There were 19 different studies in this meta-analysis, and this parallels the work that's been done with adults, which also showed that there was a strong inverse relationship between self-compassion and psychopathology. So the more self-compassionate you are, the less likely you are to develop depression, anxiety, and stress, and the less depression, anxiety, and stress you'll have overall. There was another meta-analysis that was published in 2019 by Palmer and her colleagues. And this looked at the relationship between self-compassion and specifically depression in teens. There were 18 different studies in this meta-analysis, and the findings reflected the same kind of thing, which is that self-compassion was inversely associated with depression, and that girls between the ages of 12 and 16 are at a higher risk for low self-compassion and higher depression. And this is something that has been out there in the literature for some time, that among females from the time that they're 11 or 12 to the time that they're 18, the depression increases. And to the point where at around age 18, they're twice as likely to be depressed as males of the same age. And that stays the same. That statistic stays the same throughout adulthood. Adult women are twice as likely to be depressed as adult men. And so now I'm going to look at a couple of individual studies. This first study looks again at the relationship between age and depression. So similar to what I was just saying, as adolescents get older, particularly for girls, depression increases. And you can see that in this graph. So on the bottom, you see age going from age 11 or 12 to age 18. And on the left, on the vertical axis, you see depression. So you can see in all three of these lines that as adolescents get older, depression increases. But it increases less among those with high self-compassion. So the lowest line there, the one that now has a circle around it in red, represents those adolescents who have high self-compassion. So you can see that their depression does not increase as much as those with average self-compassion, which is the middle line, or low self-compassion, which is the highest line, that where you see the steepest slope. This comes from a study that I published with my team in 2016. In this study, what we're looking at is the relationship between stress and depression. We know as stress increases for teens, actually for everyone, depression also increases. But among those teens with higher self-compassion, it increases less. So here in this lowest line that is now circled in red are those teens who have highest self-compassion. And so you can see that the relationship between stress and depression still is positive. So the more stressed they are, the more depressed they become. The increase is less than those with average levels of self-compassion or those with low levels of self-compassion. Here we're looking at the relationship between depression and non-suicidal self-injury. So that's cutting or adolescents who hurt themselves in ways where they're not intending suicide. They're intending to hurt themselves. So, and we know that this is very common. I think about 12% of teens, thereabouts, engage in some kind of non-suicidal self-injury behavior. So we know that the more depressed you are, the more likely you are to engage in these what we call NSSI behaviors. But among those teens who are higher in self-compassion, you see less of a relationship. So they're still more like, as depression increases, they're still more likely to engage in non-suicidal self-injury, but not as much as those teens who are lower in self-compassion. And this was a study that came out of Portugal. And this is a study that looked at the relationship between self-esteem and mental health. This is a study that came out of Australia. And they assessed ninth graders, over 2,000 ninth graders. And they looked at particularly those ninth graders who were low in self-esteem. And then they assessed them again in 10th grade. And what they saw was that among those who were low in self-esteem, those who had high self-compassion, there was no change in their mental health a year later when they were in 10th grade. But among those teens who were had low self-compassion and low self-esteem, they had much worse mental health a year later. So there are some teens who have low self-esteem and low self-compassion, but then there are some teens who have low self-esteem and high self-compassion. So high self-compassion is a protective factor or buffers against the negative effects of low self-esteem. In this study that was published a couple of years ago, we're looking at the relationship between self-compassion and social anxiety. And what we know is that the more self-compassionate you are, the less likely you are to have social anxiety. So again, there's a negative correlation between these two different constructs. But what we see here are that there's two different things that act as mediators or explain why or how self-compassion influences social anxiety. The first one is fear of negative evaluation. So in other words, there are teens who are afraid of being negatively evaluated or seen in a negative light by their peers. And those teens who are more self-compassionate have less fear of negative evaluation and therefore have less social anxiety. Also, cognitive avoidance is defined as intentionally avoiding your negative feelings that are coming up. So pushing away feelings of hurt, feelings of pain, feelings of sadness or distress. Sometimes we tend to avoid those feelings because they're not comfortable. In fact, they elicit a lot of discomfort. So among those teens who are self-compassionate, who spend less energy avoiding those negative feelings, they experience less social anxiety. So in other words, fear of negative evaluation and cognitive avoidance are explanatory factors that explain why teens might experience social anxiety. There are several other studies that have been published that also explain this buffering effect of self-compassion, of how self-compassion can protect against some of the negative mental health or what we call psychosocial outcomes of being a teen. So this is one study that was done among teens in China, and it involves chronic academic stress. We know that when teens are under a lot of academic stress all the time, they experience worse overall emotional well-being, worse mental health, worse negative mood or negative affect. But those with greater self-compassion experience less negative mood or negative affect. In another study, this was a study where teens had experienced maltreatment as youth. And as teens, they experienced negative psychological health because of what they had experienced when they were younger. They had been victimized as children and had suffered some poor academic performance as teens. Those who were assessed as higher in self-compassion experienced better mental health than those with lower self-compassion. And lastly, this study that was conducted in Israel looked at the after effects of a traumatic event. This was the trauma of a forest fire that occurred in northern Israel, and several villages had to be evacuated, villages where refugees had been living. those who had experienced the traumatic event and had to evacuate experienced PTSD, depression, anxiety, had some suicidal ideation. And yet those who rated higher in self-compassion experienced less of these negative psychological symptoms. So I'm going to shift a little bit now. I'm still talking about research, but I'm talking specifically now about intervention research. So this is a few studies where teens experienced a program, either a mindfulness program or a self-compassion program. In this particular study that I'm about to talk about, actually it's two different studies. They experienced a 5-day-long retreat, a mindfulness retreat. The program is called I Be Me. And in this program, they take teens out into the wilderness and teach them mindfulness for 5 days. What the results found in this study was that there was an increase in positive mood and an increase in how satisfied these teens were with their lives after the program was over. They also experienced less rumination. So rumination is thinking about and worrying about certain thoughts over and over and over. You know, when you have recurring thoughts in your mind that repeat themselves, you know, and you're dwelling in these thoughts. The second thing that decreased was their perceived stress. So in other words, how stressed they assessed themselves to feel. And also their depressive symptoms decreased post-intervention, after the intervention. But the interesting thing about this is what was driving these different very positive outcomes. And what they found was that mindfulness was driving some of the outcomes. So mindfulness, how mindful the teens were, or their change in mindfulness from beginning to the end of the retreat, was affecting positively their mood, their positive mood, their rumination, and their stress. So they're experiencing less rumination, less stress, and more positive mood because they were becoming more mindful. But also, self-compassion was driving a number of these outcomes. Because they were becoming more self-compassionate, they were experiencing more positive mood. They were more satisfied with their lives. They had less rumination. They experienced less stress, and they had less depressive symptoms. So self-compassion was actually driving more of the outcomes than mindfulness, even though this was a mindfulness retreat. They weren't directly teaching self-compassion, but they were implicitly teaching self-compassion. So there's self-compassion in mindfulness, and there's mindfulness in self-compassion. It's very hard to disentangle the two. So in this mindfulness retreat, they were getting some self-compassion experiences as well. But what they saw in two different studies, 2 years in a row, was that self-compassion was driving more of the outcomes than mindfulness itself. So knowing that self-compassion is healthy for us, is good for us, and good for adults and for teens, we developed a self-compassion program specifically for teens. And this was a program that I developed with a colleague, and it was adapted from an adult self-compassion program called Mindful Self-Compassion. The Mindful Self-Compassion program for adults was developed by Kristen Neff and Chris Germer, and we adapted it for teens. Originally, it was called Making Friends with Yourself. We have recently changed the name to Mindful Self-Compassion for Teens. The program is 8 sessions long. Each session is an hour and a half. We teach it to teens ages 11 to 18, although we never teach that whole range of ages in one group. We'll teach either 11 to 14-year-olds or 15 to 18-year-olds, or 11 to 13-year-olds and 14 to 16-year-olds, but we won't have that whole age range in one group because they're too different developmentally, and the kinds of things that they struggle with are very different. This is just some of the data that we have published already on this program. We have seen increases in resilience and what we call curiosity and exploration. And what that is the tendency to reach out and to try different things and to explore, to embrace new experiences. We have also found decreases in negative mood, in anxiety, in perceived stress, how stressed teens see themselves as being. And we have found decreases in depression as well. And what we found was that mindfulness, the change in mindfulness, how mindfulness the teens are, or how much their mindfulness changed from the beginning to the end of the program, was what was driving the decreases in anxiety and how stressed they assess themselves as being, and in their depression. And self-compassion was driving their resilience, their curiosity and exploration, as well as their how stressed they see themselves as being, and also their depression. And this is the last study that I'm going to be talking about, and also the most recent study. This is a study that we did with transgender teens, and this is a study that we did only over the last year and a half during the pandemic. So it was done all online, conducted all online, with 3 different cohorts of transgender teens. So in the first graph, in the upper left, you'll see how self-compassion changed. And there are 3 different time points. The first time point is before the intervention. The second time point is right after the intervention was over, after the 8 sessions. And the last time point is 3 months later. So you can see self-compassion increased dramatically from the first to the second time point, and then increased a little bit more by the 3rd month after the intervention. And in the second graph, in the upper right-hand corner, what you're looking at is depression. And what we see here is that depression decreased pretty dramatically from before the intervention to right after the intervention, and then decreased a little bit more at 3-month follow-up. And then in the graph in the lower left, what we have is what's called perceived burdensomeness. And this is how much teens perceive themselves as being a liability to others around them, particularly to their families and to their friends. So how much they perceive themselves to be a burden. And this particular factor, as well as the next one I'm going to talk about, which is called thwarted belongingness, what we know about these two is that they're correlates of suicide ideas, particularly suicide ideation. So we know that these are 2 different factors that, if they're both present to some degree, that it is likely that the teen has also experiences thoughts about suicide. So what we see in the lower left-hand, the graph in the lower left-hand corner is perceived burdensomeness, and we see this is decreasing from pre to post, right after the intervention, and stays about the same, increases just a slight bit at 3-month follow-up. And just to say a word about that slight, very slight increase, which is likely not significant, we often see a waning of effects at 3-month follow-up because they're not, the teens are not practicing as much. They're not meeting weekly, or in this case, the teens were meeting twice a week. And so we often see waning of effects at follow-up. So it's really very positive that we didn't see waning in self-compassion or depression, the first two graphs that I talked about. Okay, so, and then thwarted belongingness. So thwarted belongingness is when teens feel a desire to be accepted and to belong and to be part of a peer group, and that they're not successful with that they feel like they don't belong. And again, as I said earlier, this is one of the factors that's correlates with suicide ideation, thoughts about suicide. What we see is a dramatic drop in thwarted belongingness from pre to post intervention, and this continues to decrease to the 3-month follow-up. So we felt really good about these results, and especially since this was done during the pandemic when stress is high and also completely online. So now I'd just like to take a moment at the end to address how to engage teens, because I'm frequently asked this question. How do you get teens interested in your program? You know, how do you get them to come? And it's hard, right? Because it's a teen's job to become their own person. It's a teen's job to resist whatever adults are suggesting for them. Some teens more than others. So it's a challenge, but we do have some tips. First of all, make it an invitation. You don't want to ever tell teens that they have to do these practices or that they have to come to a program, because that is just setting up a wall for them to push back against, something for them to resist. You want to make it an invitation. You want to say to them something like, this program is here for you. It's been shown to have a lot of positive outcomes for teens. It's shown to have teens who take this program have less anxiety and depression after the program. It helps a lot of teens. I'd like you to take part, but allow them to, empower them to make the decision to do it themselves. So there you go, second bullet, empower them to make the choice themselves. And again, I addressed this already, recognize that resisting is where they are developmentally. They're not trying to be difficult, although it may seem that way at times. They're not trying to give you a hard time as a parent or as a teacher, or even as a therapist, but that this is where they're supposed to be developmentally. They're supposed to be developing their own identity as people, and so expect some resistance. And listen. This is really important. You know, as adults, we often feel like we have all the answers, and we've been on this planet longer than teens, of course. So we do often know more than teens, and out of the goodness of our heart, we want to share this with teens. Yet teens are not going to listen if they feel like they are being spoken to They're much more likely to take in your wisdom if you also listen to them. And frankly, what I have learned is that teens have a lot of very wise things to say themselves, and I have learned a lot from teens. So I would encourage you to listen, to really listen. And listen doesn't mean just, hear their words and let them go by you. It means really deeply listen to what they have to say. Also, to keep any practices, meditations short, no longer than 10 minutes, and that's only after they've been doing it for a while. Teens aren't used to meditations, and so if we right off the bat give them a long meditation, it's going to seem burdensome to them and boring. So we keep things short.